Uh, Welcome back to Private Parts of Wellness. This has been a long time coming because I've been doing a lot of shit. Um, but I asked you in my newsletter or my email, my little love letter, if you wanted me to talk about something and what that was. And I was asked to talk about body, weight, what's going on in the world. This is probably going to be a more unhinged situation because I'm using some notes that I made, but I don't have a script. Sometimes I try and do that. It never really works out. It's usually always unhinged, but I have literally about a half hour to do this. And so, what are we talking about again? We're talking about weight. And of course, like every single episode, we're going to be talking about menopause, sex, hormones, and aging. These are the private parts of wellness. If you don't know me, my name is Jessica. I am a family nurse practitioner. I am also a certified menopause provider. I also did another certification in women's health, and I've been talking about sex and sexuality since, forever. Forever for menopause, because I started talking about that when I was in seventh grade. Thank you, Sunny, for reminding me of that. And I've been lifting weights since I was 16. When I was 16, I was a bodybuilder and I was dancing at the same time. And I continued that until I graduated from high school. Was I 16? Maybe I was 17. Who fucking knows? That was the 1900s. There was a lot going on. But yeah, in 1990, I stopped. I'm drinking coffee, so I could be highly caffeinated for this as well. In 1990, I stopped. I came to college. I didn't have my trainer anymore. The bitch was bougie. Me. My trainer, Lizzie Davidson, if you know her, she's out of Chicago. She's French. She was Miss Natural Illinois, over 40, Miss Natural, meaning unmedicated. And she used to train me in a thong at the CFC, Chicago Fitness Center, where there were a lot of big people lifting weights. I have a love of health and sex. And did I mention that I've been talking about sex and sexuality since about 2010? Been studying it. I didn't know you could study it. Formally, so I kind of self-taught. But anywho, we're going to be talking about lots of things and around the body, around weight, around body image. This has been something that I've obviously dealt with for a long time. Sometimes I wonder if it's my family. My father was a very, very heavy guy. And he had no grace around his size, and therefore I had no grace around his size. I had a group called the Mistresses of the Menopausal Mind, and somebody in that group, and I knew her. We grew up together, and I knew her dad, who was also really big. And the way she talked about her father so lovingly and such kindness and gentleness and generosity around size really made me step back and think about the messages that I have received around size of bodies and what their limitations are and what their desirability is. If you also subscribe to my newsletter, which is not on privatepartsofwellness.com, you actually have to email me, Jessica at ppwfnp.com, and I will put you on that list. You will do the work of emailing me and saying, hey, I want to be on it, and I will send you these emails. But if you have seen those emails, I talked about the politics of desirability and this book that I found. I can't remember the name of it right now. I got lots of shit going on in here, but I'll send it to you if you email me. I'll send you the information about the book. And anyway, back to this person who is in my group, same name as mine. That's all I'm saying about them. And our dads were very similar in so many ways. Anyway, the kind of grace that she showed her dad was really touching for me and a learning point for me. It kind of like, what the fuck is wrong with you, Jessica? But I also have, as you may or may not know, the Queen Diva herself, my mother, who is an actress. And there is a lot of messages that she received around her body and who she was and her image. Race also plays into it. But today, again, I'm going to be talking about me. I'm going to talk about the science. I'm going to talk about what's going on. And just maybe I'd like to hear your thoughts and ideas on this as well. So a little while back, I was walking around and I saw the back of this young mother. Now, I don't know how young she was. If you are in your 30s, you're 20, years less than me, so that's a lot younger. Um, and looking back at my motherhood journey, probably when I was 32 and having my first kid, I was a young mom in certain ways. Anyway, I'm watching her following this super, super young toddler, like a true toddler. This kid learned is straight up toddling. And I was watching the mom and how she looked in her presentation and what I imagined, assumed, you know what happens when you assume, but what I imagined is that she had a very, very different body before she had this toddler. And there were parts of her that were round where they probably weren't before, and her underwear was ill-fitting. You could tell through the sweatpants. And this was not, I was not looking at her with any, I was just watching her, navigate and remembering how hard that was, but also thinking about this concept of, that people wanna buy into, that you have to get back into your pre-pregnancy weight. You have to get into your pre-mom body, and how fucking unfair that is. And also, why our bodies need to adapt and change when we go through these huge life transitions. Remember, you are perfectly great as you are right now, and your body is serving a particular purpose, even if it's having challenges. And I think about like the watching my youngest right now go through her body changes, because it's almost as if we shed these old skins and these old forms each time. So we think about the newborn baby, the smells change, the poop changes into the settled baby sitting, how the face starts to change there, into the crawling baby, the toddling baby, into the, you know how it goes. And then we go through puberty and how long that journey is. And then if we choose, there's a settling that happens, actually, not the if we choose part, but there's a settling that happens, I want to say, at one point in our 20s, where we kind of settle into our adult body. But that adult body may not stay the same forever, because you may go through other life journeys, like creating human beings and then pushing those human beings out, and then maybe making sustainable food for those human beings. And then you get the point. So when I think about this new kind of puberty in reverse, one of the things that we notice is, of course, that for some of us, not all of us, there's a distribution of fat, a redistribution of fat that happens. And we're going to talk about that in a little bit. But what is that for? And it also has a purpose. But what seems to happen right now is that society seems to think that the purpose uh, of the fat is, I don't think I'm saying that right, but society right now is thinking that we need to get rid of that fat redistribution. And you can't have any of it. You got to be super lean. You got to be super thin. You got to be blah, 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 blah for longevity. I've always fought against that, because, if you look at even that blue zone situation with people over 100, and you look at these kind of older folks, they don't look necessarily brittle. They may even have a little cushion so that they can pop and bounce off just a little bit, maybe. Um, Again, I'm not using a script, so I'm just like spewing. Hopefully this is making sense for you. So I think about my own body, and I think about, as I said before, I used to be a bodybuilder, and I went through what happened to me in 1990 when I came to New York from Chicago, which I still consider myself a Chicagoan. I know that sounds crazy, because I've lived here in New York longer than I lived there, but that is my home. That is my roots. That is, a Chicago person is very different than a New York person, right? A Midwestern girl. Anyway, when I came here, all that muscle that I had created, and I had 11.5-inch biceps, 42-inch lat spread. 42-inch lat spread, like leg press about 325 on my regular rep weight, and I was a power bench presser. So all that turned into fat, like it just dissolved. I couldn't get to the gym. I couldn't get focused. I couldn't do that shit by myself. I needed a reason to show up to it. And so for me, what kicked in is that programming I have that was not a good body anymore. That was not an okay body. That body had more fat than muscle. That body was almost, well, it was gross in my mind for me. So fast forward, giving birth to my third kid. First of all, when I get pregnant, I get close to 200 pounds. Like, that is not a joke. That is absolute truth. In fact, my second pregnancy, which was a home birth, I went to see the doctor that was going to give me a C-section if that needed to happen, or meet me in the hospital if I couldn't do the home birth. And he literally said to me, "How come you get so fat and your baby is so small?" I said, "Because I do. Because I have fat cells and they like to blossom. They like to blossom. And you know what? I also breastfeed for a long fucking time after." Third pregnancy, after I gave birth, 2 months in, postpartum, I went to go visit my in-laws to show them this baby and introduce them to this baby. And the first thing that I was told, now I was not feeling good in my body, was how fabulous I looked. I was definitely still holding on to that baby weight, because remember, 200 pounds, I was maybe 170 at the time. I was not feeling good about my body, couldn't fit into my clothes. Everything was like clinging to, and I did not feel sexy. But when I'm big and pregnant, 200 pounds, I feel hot as fuck. Hot as fuck. Anyway, fast forward again, just recently, now that I am working through this late stage perimenopause. God, I hope every period is my last. I hope. I again have gained a lot of weight. I'm working out every day, or almost every day, doing different things. I hate cardio. I hate it with a fucking passion, but I love lifting. And I'll tell you what I like to lift. Or you can send me an email and I'll send you what I like to lift. But anyway, fast forward, just recently I went to go visit my mother-in-law. And the first thing she says when she sees me, gives me a hug, gives me a kiss, and she says, "Oh, gorda." She says I'm gorda. Duh. I'm saying it wrong. Gorda. Fat. She told me I was fat. But this time I didn't take offense to it. I really did not take offense to it. In fact, I had lost about 10 pounds since June. And I was feeling pretty good about my body. And I knew at this point that she did not mean that as an insult. She meant it. I looked healthy. I looked juicy. I looked moist. I looked like a lamb chop. And I was loving that. So again, it makes me think about also what cultures, meaning the difference between the United States, or whatever the fuck we need to call this place anymore, because they're united does not feel right. But anyway, I don't know that it ever did, but more than ever, it doesn't at this point in time. We have these images of the United States of what we should be. And when we think about this menopausal journey, like it's getting super nutty, right? Everyone's dropping weight, trying to look thin. Kate Moss, there's a doctor out there with her weighted vest, and she's like, "It's a 12-pound weighted vest, which is 10% of my body weight." And like, this woman is 5'10", so she's 120 pounds, and she's like 5'10". That ain't me. I took a sip of my coffee. Sorry if that's annoying to you, because I kind of slurped it. It makes me think about, as you know, I'm a nurse practitioner. So one of the things we have to do is this BMI. I always preface BMI when I tell people I really don't give a shit about your BMI. Honestly, I'll use it if I need to for insurance purposes, but I don't use it for anything else, because it is, again, bullshit. It was invented in 1830. If you do not know this about BMI, let me tell you. It was invented in 1830 by Belgian statistician Adolf Quetelet. Like, I'm probably saying that wrong. And it was then adopted by insurance, and it was based off of European men. Obviously, the European men, or maybe it's not obvious, but these were European white men. 30% of the people with obesity are metabolically healthy. 20% of normal weight people are metabolically unhealthy, even when the BMI is within or without the norms. Let me just kind of preface that again, because that was probably really confusing. So this whole BMI thing, which is looking at your height and your weight, right, is a bunch of crap. And it's been adjusted for, female, male, but it's a bunch of bullshit. And you can look at somebody who is BMI super high because they are all muscle, like that rugby player. What's her name? Ilona or whatever. I think she's got a really high BMI. She's not metabolically unhealthy. But somebody would be like, oh, your BMI is too high. And you can have somebody who's got a very low BMI or a normal BMI, not very low. Obviously, that wouldn't be great, but like a normal BMI, and they could be just a hot fucking mess. So the BMI is absolute crap. Now, one thing that is when we are thinking about like weight and weight loss or weight composition and health, one thing we can look about is waist circumference versus height. And so you just do weight divided by height. So for example, if you are 56 inches tall, then you want to have a waist circumference of 33 or below. If you are less than 0.5, so 50%, of your waist circumference to your height, that's low risk for metabolic health problems. And if you are 0.5 to 0.6, it's moderate. And then over 0.6, you've got a high risk. And the idea of the BMI was that if you had a high BMI, well, this is predictor of diabetes, fatty liver, heart disease, that sort of thing. But actuality, waist circumference is a better indicator, but not all the time. So, like, when is it not? Well, I'm going to give you an example. I recently saw a patient who was over 400 plus pounds. This was a female bodied patient, a woman, and she had normal periods. And one of the first things that I ask as a provider when we talk about it, because it's always going to come up, right? When somebody comes in and they are a larger sized person and I am seeing them as a provider, I know I can pretty much bet money that they're already going to have a wall up. They're going to think that my focus is going to be on their weight, and everything that I have to say is going to be lose weight, lose weight, lose weight. Oh, you got this problem? Oh, it's got to be because you're fat. You've got a period problem. It's got to be because you're fat. You got this problem. It's got to be because you're or the assumption that they are going to have problems. Anyway, so when we're doing this first initial intake, I explain my feelings about the BMI. And then what I ask them is your body doing what you need it to do at this time? Do you feel good in your body? Are you fucking? I don't say that, but you understand. Are you pooping? Are you peeing? Are you moving? Can you get up and off the floor? Can you do what you need to do? Can you dance? Can you walk? What is happening? Are you pain-free? Because pain is never normal. Pain may be typical. This is just a rule for life. Pain may be typical, but it is never, ever normal. So I ask them, is your body doing what it needs to do? So this particular patient, young person, said, absolutely. I said, is everyone big in your family? She said, we are all big in our family. And I said, well, I'd like to check you because you haven't been to the doctor in X amount of years. She was young, 20. So she's just experiencing, I think she's like 20, maybe 19, whatever. But, just approaching adulthood, just putting her toe in it. So I said, I'd like to do a whole bunch of labs on you just to get a whole picture. And I'm not talking about, I wasn't doing anything extraordinary. I wasn't searching for problems that were not there, but just general labs. Cholesterol, because she is big, right? I want to do A1C because she's big, but see, here's where I may have been faulted. There is no indication on her skin that she might have a sugar issue, right? There is no, you see where I'm going. But I wanted to do just the basics, like how's your sugar, how are your lipids, how's your heart, blah blah blah. You get the idea, right? And she was like, I have no problems. You do it all. Let's get it done. Lo and behold, did she have any issues? Yes, she did. You know what her issue was? Her vitamin D was low. Her vitamin D was low, but she was good, top to bottom, good. There was nothing going on with her. Her sugar was good. Her A1C was perfect, not even borderline high. Triglycerides were a littler on the high side. We discussed that, but they were still normal. Maybe in the functional world, in the integrative world, they were not optimal, right? But she's got time for that because she's a young person. Anyway, we talked about that. And for her, obviously, waist circumference at that size, because she wasn't a giant. She was tall. She's tall. She was tall. She was taller than me. Um, but she wasn't like a giant where, her waist circumference she wasn't like 7 feet, right? Because she's 400 pounds, you can imagine. So in that case, we're not thinking about this idea. It's again, is your body doing what it needs to do? However, when we get older, that's when we start to have to really think about our waist circumference to height. Because what'll happen is that all of the external will start to move internal. Does that make sense? It starts to come internal. So we start to think about visceral fat. Around 40, 50 is when it matters most. Around 40 years old, right? Is when we really start to think about that external fat becoming internal, and we start to think about something called visceral fat. And the visceral fat, the organ fat, starts to increase. And why does that happen? Well, we start to think about a decrease in our hormones or sex hormones. For men, testosterone is the one that we really think about often. For men, it starts to drop about 1% at the age of 30. For women, and we're talking again, assigned at birth, sex assigned at birth, okay? For women, testosterone is usually around 15 to 70 nanograms per deciliter. And it has maybe a possible 50% decline around the age of 40. Now, you also do, when you're thinking about testosterone, you're also going to think about something called sex hormone binding globulin. You're also thinking about your free testosterone. And what testosterone does for all human beings is it supports muscle, bone, libido, and energy. I am using my notes here. And what happens with estrogen around the same time is that you've got 4 types of estrogen. 2 are made when you are having a baby friend, meaning pregnant and after a little bit. And then there's the 2 that are one that's coming from the ovaries and estradiol, and then one that's coming from fat, the visceral fat. So when our ovaries are not making the estrogen, we need to make it somehow. So we're thinking through the liver, cholesterol goes up. When we start going through the menopause transition, you might notice, right? You start gaining more fat around the belly because fat also makes more estrogen, right? And so you start to get more belly fat with estrogen loss, bone loss up to 8% in the 5 years post-menopausal. Wow. So we also have to think about strength. So if we're losing strength from testosterone, we're losing bone strength and muscular strength and energy in general from the decline of our hormones. Well, then we're thinking maybe this fat is going to go more internal to try and make more estrogen, and things may start to feel like not great. This also gets me thinking a lot about like middle-aged people, and we think about a mom bod and a dad bod. Well, like there's no such thing as a mom bod, right? There was that whole thing about like zaddy shorts and the dad bod and like, oh, that was the hotness. I don't know what the fuck that meant. Maybe there was like one of the beauties of being in a long-term relationship, and we're talking about decades with somebody, right? Or a decade when you really see them transition. One of the gorgeous things that you do get to see is you get to witness the changing of their body, at least for me. for me. That's always been kind of this beautiful experience. Maybe having grace for my partner and not for myself, but at the same time, we both like to exercise. You see what I'm saying? We both like to exercise. But anyway, it's interesting to me that there was that whole thing with the dad bod, but there's never been like this interest with the mom bod. Nobody's like, oh, I love that little like fupa that you get, like that baby pocket. Um, I love how your breasts just hang down and your nipples can just like gently brush the top of your belly. I mean, maybe that is somebody's kink, somebody's fetish, somebody's thing. I love how your ass has changed as you've aged and given birth to people, and like it just like dropped in that particular fashion. I don't see that happening. I see the absolute opposite. Again, going back to that mother that we thought of, or I thought of, that I saw, that kind of sparked all this, that, oh, if I could only get back to that pre-blank weight, if I could only look like that, to be 110%, why the fuck would I want to be anything like what I was in my 20s? Because that chick was a hot fucking mess, making bad decisions, top to bottom. I don't want to be that. I don't want to be that. So if I have to look like that, I might have to live like that. And I'm not doing that. Thank you. Talking about desirability, talking about weight loss, talking about this desire to be super skinny, we now see a big push for GLP-1s like Ozempic. Ozempic is semaglutide or tirzepatide, which is the Zepbound and Mounjaro. So there's Ozempic, Wegovy, and then there's Zepbound and Mounjaro. And we've seen a huge push for that. We've seen larger celebrities drop a significant amount of weight. And we see the push for microdosing. And in the menopause space, it is like non-fucking stop with these companies who are now like, we're going to take care of the perimenopause. We're going to take care of the menopause. And also, we're going to help you get rid of that meno belly. And I've fallen prey to it too. I will tell you that. And I have to say, like, there's some good things about it and some not so great things about it. There's right ways to do it and wrong ways to do shit. And again, the best way to do something is to feel good while you do it. So maybe we could talk about that a little bit later. But one of the things that they talk about is using these GLP-1s for metabolic flexibility. And again, I have a young person, over 400 pounds. She is metabolically healthy and yet obese. But the thing is, like, let's think about it a little bit. Let's think about this aging. So you've got aging, loss of your hormones, gaining weight. You get on the semaglutide, the Ozempic, which was the first one that people want. And look what happens. I'm going to show you this. You probably can't read that, but it says, what is Ozempic vulva? And is it a real side effect of GLP-1 drugs? Well, hot diggity damn. These people are dropping weight so fast that their puss is like a little flapjack now. Now, with aging, your vulva is going to change, by the way. The first thing that we can see when you are getting older and you're like middle-aged, you could look like you're 20 on the outside, and like if somebody sees, now I guess if you're doing a Brazilian, it's not going to happen, but you can see the pubic hair pattern and you could be like, oh, this chick's over 40. Why? Because the hair gives you away. There's a hair pattern that changes. You have vulva pattern baldness. That starts to happen, okay? That is a real thing. I don't know if it's really called that, but that's for realsies. That's true. I never know what to look. Do I look here? Do I look here? I don't know. I'm kind of looking at myself. But anyway, the other thing is that your inner labia may start to shrink. The other thing is that you may have more vaginal discomfort. And this is all through the perimenopause, menopause, and postmenopausal journey. But now this is saying you can also get, as you strive to look your 21 self, and I'm not saying everyone's doing that, right? Like, that's definitely not my goal, and I'm not trying to shame anyone. I have no This kettle is black, or however that shit goes, right? But what's happening is that in addition to this, because of rapid weight loss, people are having these vaginal side effects. So this says, and there's one published case study of a perimenopausal woman experiencing vulvar bleeding. According to one clinical trial resource, just 41 people who experienced vaginal bleeding while taking, this was Trulicity, 34 from Ozempic, and none reported from Wegovy or something. No vaginal infections were reported. One of the things that is happening here is that one study showed that glucagon peptide 1, GLP-1, is utilized by many strains of Enterococcus faecalis, a very common urinary tract pathogen and one of the major players in a case of aerobic vaginitis. E. faecalis, a gut microbiome, commensal, meaning it belongs to the digestive system, but it does not belong in any meaningful levels in the urinary tract or vagina. Anyway, they're saying that these strains can disrupt the epithelial barrier and steal GLP-1 from the digestive system, where the blood sugar. Anyway, it seems like it's having a little bit more issues on greater health. And one of those things, again, is that it's creating an Ozempic vulva, sagging skin, vaginal dryness, and weaker pelvic muscles. The sagging skin is likely the effect of a rapid weight loss rather than the weight loss drug itself. And the pelvic floor, physical therapy, vaginal lubricants, and topical estrogen may help with some symptom management. I think one of the things that's happening when people are taking these GLP-1s is that they're not necessarily exercising, and they're not lifting weights, and they're not doing the kind of lifestyle modifications that they need to do. And these are modifications that you have to think. It's not to get like the bikini bod or the whatever bod or look like she used to look. The idea is that we need to prepare ourselves for becoming 80, for becoming 90, for becoming 20, to fall in the fucking, did I say becoming 20? For becoming 100. We need to be able to get down on the floor and bounce the fuck back up. I got to tell you something about my own mother. We were talking last night, and I said, but you know what, Mom? We were talking about leg strength and building her quadricep muscles. My mother's going to be 86, and she's lost a lot of muscle mass because she's going to be 86. But I said, I think, because I've seen it, you can get down on the floor and get back up. She's like, oh yeah, I can totally do that. Like, the woman can lay down on her belly on the floor and get back up, period. That's what we're talking about. And this is because she has had a lifetime of exercise. Okay. So when I was looking at these studies, I mean, these studies that were done, this whole Ozempic thing is really kind of hearsay. It's people talking, and the main thing that I found was a case study on tirzepatide affects sexual function in women. So I want to just point that out. So the abstract is tirzepatide is a molecule capable of controlling blood glucose levels, dual agonist, blah, 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 blah. It's used, this is Zepbound, right? The purpose of this report was to present a case study of an obese female patient who received tirzepatide treatment for sexual dysfunction. The result was that a 36-year-old woman with obesity class 3 developed sexual dysfunction after using tirzepatide. A healthy lifestyle with a carb cycle diet, greater physical activity, and exercise for losing weight. All physical, psychological, and hormonal parameters were normal. During treatment, the patient started to complain of decreased sexual drive, genital dryness, and failure to catch orgasm. Female sexual function index 12.7, symptoms decreased after stopping the tirzepatide and reappeared after retaking the injection after 1 month of sexual treatment and support. The conclusion is that the drug's impact on hormones and neurological pathways may contribute to a decrease of sexual desire through the specific process, though the specific process is unknown. Adjunct sexual education and therapy support has an imperative role in the plan of management in cases ongoing in the journey of reducing weight and complaining of sexual performance. Like, here's the deal with this person. This is one person's story, and they were 157 centimeters tall. I don't know what that is in inches. And they were 123 kilograms. So you multiply that times 2.2. So if we get, so that's 246. And then we add 0.2 to that. So like 250, 260, 270, something like that. And her BMI was 49.1. We can't take this and say, like, if you do it, not only will you have like a sad vulva, but you're also going to lose sex drive, because we don't know what might have been also going on with this person internally. And they were young, meaning internally, like their spirit. I think that the idea is, and I'm going to wrap this shit up. Okay. The idea is that, number one, we need to have grace for our bodies. And my personal feeling is that, like, these heavy duty weight loss drugs, which are life saving, like, I believe that had GLP-1 been around when my dad was alive in the way of obesity medicine, he would be here today. So I love these medicines for certain people. And I love them for a lot more people if they're done properly. But what I really want for us all is to appreciate the bodies we have today. And know, like, I am sad that we are all fusing into one image. Like, the only thing that is united in these states is this bizarre desire to look like three different people. You see what I'm saying? Whether you want to look like a Kardashian, or you want to look like I don't know, whatever the equivalent of like Kate Moss is today, or you want to look like a TikToky. You know what I'm saying? Like, there's like three looks. It's all fucking millennial beige. And you know what I didn't tell you? The opposite of the gorda is seca. Am I saying that right? Meaning dry. Because at the end of the trip, we saw this TikToky girl getting on the plane, and she had on a bodysuit, shorts, like a unitard bodysuit thing, and she was tall, and she was skinny. And I'm sure on the TikTok, it translates as curvy and cute. But my husband quickly pointed out that she looked seca. I don't think it's, is it seca? Because when I think of seca, do you know who I think of? If you're from Chicago, you may know who I'm thinking about. Seca means little girl in Yugoslavian, I believe, and porn. I'm thinking about porn. But what he meant is she looked dry. Weight doesn't equal health. Your hormones, sex, age, those really matter. And when we think about wellness in general, like, none of this is neat and tidy. It's all kind of messy. So I don't know. I hope you learned about the BMI. I hope you learned a little something about waist to height ratio. I hope you strive to be juicy. Practice falling on the floor and getting back up, rolling around, lifting heavy weights, if that's your thing. And maybe keep a little love handle, something to grab onto. That's about it. If you're interested in getting on that email newsletter, let me know. Send me a message at jessica@ppwfnp.com. And let me know. Let me know how you felt about this episode. It was slightly unhinged. Let me know what your thoughts are on your body, aging, weight loss. Let me know how you have come to terms with who you are or your family or whatever, all of it. And if you are an obesity expert, if you know something, because I am not, let me know because I'm really curious to learn more about this. That's about it for today. Oh, if you want to work with me, let me know. Again, send me an email. Thank you for listening. Please rate, please review, do all those things. Have a great time. Let me know what you want to hear. Um, Newsletter, we talk about sex, we talk about kink, we talk about aging, hormones, whatever nonsense is going on in my head. And that's it. Bye.